guys, in today's video I'm going to talk all about platelet-rich plasma, aka PRP, for acne scars. As a reminder, I recently did a video talking all about PRP for hair restoration and hair regrowth, so check that out if you're suffering from male or female pattern hair loss. I go into the studies on PRP for that there. But acne scars. Now, acne scars can be either atrophic, meaning they appear as a divot in the skin, or they can be ice pick scars, meaning they just look like a little hole. And it's important for you as someone with an acne scar to understand that scarring is a largely permanent skin problem. However, there are procedures that can be done to improve the appearance of a scar, but there's really nothing that truly takes away a scar, merely treatments that can improve the appearance. Now, I've got videos all about the different types of acne scars and the different types of treatments that can be done. Things like TCA cross and microneedling. So check those out. I'll list them down in the description box. But what the heck is PRP? PRP is something that is derived from your blood. The physician takes your blood, spins it down, and removes a layer that has a lot of platelets in it, hence the name platelet-rich plasma. Platelets are part of the blood that is involved in clotting, but they also have these little granules that are rich in growth factors that can help in supporting collagen renewal. And that's important because if you're trying to improve the appearance of a scar, improvement in the deeper layers of the skin is really where you need to be focused. And that requires something that's going to help in boosting up collagen and this overall healing and regeneration. So there's a lot of enthusiasm for using PRP for acne scarring. And what do we know about PRP for acne scarring? Well, it actually seems like it might be helpful. Not only does PRP deliver these growth factor packets through the alpha granules that can help with renewal, but it also has a variety of other bioactive compounds that can help in calming down inflammation in the skin that contributes to scarring as well. PRP can either be delivered to your skin intradermally, and I'll get into some of the modalities in a moment, or just applied topically to the skin as a serum. There are several small studies that show that PRP can result in significant improvement in the appearance of acne scars, particularly when used alongside other treatment modalities. PRP has 3 to 5 times the concentration of platelets that would be present in a wound. And this is important when you're thinking about treating a scar because platelets are a really important part of wound healing and scar formation through those little growth factor packets that lead to regeneration, differentiation, blood vessel growth, etc. So the thought is that by delivering this highly concentrated source of platelets to the treated area that you get kind of a mega dose of it. As I mentioned in my video on PRP for hair restoration, a major reservation that I have with PRP is that we don't have long-term efficacy or safety data for it. Now, while growth factors are great for renewal and boosting up collagen production and all these wonderful things, if there are any skin cells that are pre-malignant, there is a theoretical risk, and I say theoretical because it hasn't been proven yet, that you could actually favor the formation of cancers in the local area. And I always fear that there may be pre-skin cancer cells that by delivering this high concentration of growth factors, we're essentially fertilizing the ground for skin cancer formation. But that hasn't come to fruition yet, but PRP is still a very relatively new treatment modality in dermatology. So just because we haven't seen it yet doesn't mean that it might not happen down the road. But one study used something called optical coherence tomography to examine the scar tissue, and they showed that there was improvement in acne scar depth when PRP was used with something called fractional laser therapy versus just the laser alone. So in other words, it seems as though PRP might get you better results than the fractional resurfacing laser treatment, which I went into in my video on treatments for scars. Remember, that is one treatment that can definitely be helpful for scars. It's fractional laser therapy. Fractional laser therapy is associated with a lot of redness, however, and swelling after the treatment can happen. And what was shown in these studies is that when the fractional laser was paired with PRP, there was less swelling and less redness. So it suggests that PRP is a useful adjuvant to fractional resurfacing laser treatments, and that basically you have fewer side effects of redness and swelling. But whether or not it actually gets you that much better in terms of improvement in your scar, it's really difficult to say that for sure. Within that study, there was no difference between actually putting the PRP into the skin intradermally or just applying it topically. Both seem to have really good effects, which I always wonder, like, is it really working? Because growth factors, they're not super stable when you take them out and put them to the skin. So, you know, just applying them topically to the skin, how well do they get in? Presumably, if you're applying them topically to the skin after fractional resurfacing laser, you know, the skin barrier is impaired from that laser treatment, so you're going to get increased uptake. Okay, I can see that. But I still, you know, I have a lot of reservations that this is actually doing much. It's really expensive is the other issue with it. And there's some other studies that showed no statistical significance with PRP versus some other treatment modalities. So a lot of the data is actually kind of mixed, and nothing is really solid. Some people will argue that the studies that show no improvement didn't do enough of it, and so that they argue for more treatments, but more treatments, more expensive. For example, there's a study that showed that there was no difference between PRP and skin microneedling compared with TCA cross and isolated intradermal PRP. They all seem to be kind of the same. Major limitations with these acne studies is they use very small cohorts, meaning groups of people in the study, and they look at a very short-term follow-up of only 2 to 6 months. Why am I picking on that? The reason is that scar remodeling is a very lengthy process. It goes out to at least a year where a scar is still going through remodeling. So why haven't they looked longer? I need studies that look at longer periods of time, 1.5 years, 2 years, to show true statistical difference between PRP versus some of these other typical modalities. TCA cross, I have a video talking all about it, is very cost effective and useful and definitely helps. Microneedling also has been shown to be useful and, again, very cost effective, minimally invasive. So whether or not patients need to plunk down the added change for an expensive PRP treatment, I'm not convinced, is what I'm saying. There is, as I mentioned in my hair restoration video with PRP, there's so much variability, you guys, in collection methods. It's not standardized. And so the quality of the product is not necessarily going to be the same. I really need it to be standardized and the length of treatment standardized, and I would love to see more long-term efficacy and safety data to be convinced that this is something that people with acne scars will benefit from investing in. Having scarring, particularly on your face, has tremendous effect on your overall self-esteem, emotional well-being, and I think you're a very vulnerable population, like the people I mentioned with hair loss who are vulnerable to this. I think you're a very vulnerable population for a lot of hype when it comes to treatments and treatment modalities. I'm not convinced that this is necessarily any more effective than standard of care treatments, but it seems to be safe as far as we know. I just like to see more data with it. At any rate, it seems as though when using PRP alongside treatments like resurfacing lasers, the patients get better outcomes in terms of side effects from the resurfacing treatments. Some studies have shown that PRP along with resurfacing laser results in better outcomes as far as something called post-inflammatory hyperpigmentation. So, that's exciting that this could help people with darker skin types not have as much issue with post-inflammatory hyperpigmentation after procedure. But I really need to see those kinds of studies. And the studies, they're not standardized or consistent with the skin types that are being treated. Different skin types, and by skin types I mean Fitzpatrick skin phototypes. Those are basically referring to how your skin responds to ultraviolet light. Some people burn really easily. They're Fitzpatrick 1 versus people who are much more dark complexion and never burn. Those different skin types, they actually respond to wound healing much differently. the different skin types. So I'd really like to see more studies with better powered with different skin types to really be confident that this is something that's going to be useful to people with acne scars. Comment below though if you've had PRP or the vampire facial for your acne scars, how it went, if you thought it was helpful. I hope this video was useful to you guys. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.